offer you. We work with Head Starts and preschool on up. And so if you ever need anything, feel free to reach out to us. We are available. And we do try to work with the schools, but sometimes we don't always get in the right doors. But if you are here and you're from a school and you want us to come in, you just reach out to us and we'll make it happen with you. Because it's very important that we have these conversations with our parents, with the children, with the administrators. So we can do PTO presentations, we can do them, we can arrange for programs with children and youth, and we can talk to the parents as well and the administrators. So please don't hesitate to grab one of us or take our cards. We have much information out there on the tables. And I'm going to just put a side plug in for myself. There's an activity on my table right now, and it's writing a letter to the governor. So there's notes provided. I will mail them. But we are in the process of doing an urgent push to let him know that we want him to take the health of our residents and make them a priority for public health. So we're encouraging him to promote anything he can with public health, especially with trying to raise the cigarette taxes and to promote things that we know are evidence-based that can help us lower the rate of smoking and tobacco use in the state. So please take the time to do that. You'll see the sign on my table that says stop, and it has the notes and an empty basket with no notes in it. So please consider writing a note, and I will send those off tomorrow. So the Tobacco-Free Lake County, Indiana Coalition and the Tobacco Education and Prevention Coalition for Porter County, which is based right here in the Valparaiso University College of Nursing and Health Professions, we both have many efforts that we work on to help our residents live, work, and play in smoke-free environments. Our staff and our coalition members spend countless hours defending our right to breathe clean air and to help residents avoid tobacco and nicotine-related physical and mental health issues. We work with school corporations, healthcare providers, healthcare organizations, employers, organizations that serve marginalized populations, and we want to ensure health equity among all of those populations. We work with multi-unit housing, we work with universities, youth groups, Head Start programs, and other preschool programs. We work with the media, and we work with our local coalition partner organizations as well. The information we're about to discuss is just one of the many efforts that we are charged to work on, but it is one of our most important efforts, defending our youth and our young adults against manipulating attacks from the tobacco industry. Some audience members today are from Lake and Porter counties here in what we call Northwest Indiana region, while many of the college students today may even consider another state, county, or even country their home. Regardless of where you're from, the tobacco industry targets youth and young adults to cause that addiction to vaping and other smoking products. Big Tobacco is desperate to use each young person as a replacement for someone who has quit smoking or has died or is dying from smoking-related diseases. While the statistics and information you hear today pertain specifically to Lake and Porter counties, the message is the same across the country or even globally. The tobacco industry must be stopped in their efforts to lure our youth and our young adults into a life of addiction to vaping nicotine, which can be very quickly and very often lead to smoking or vaping marijuana, which has proven to be potentially a result that results in future addictions like Dr. DeNoble just talked about, and physical and mental health problems down the road. Today, our Porter County Voice Youth members, Lauren Jeffries and Caden Haratos, along with the Tobacco Education and Prevention Coalition for Porter County's very own youth facilitator and outreach specialist, Emily Carpenter, will provide you with the information you need to set the stage for our community conversation that follows this particular presentation. So they're teeing it up for the conversation we're going to have. The local and recent point of sale assessments conducted by our coalitions this past spring illustrate the current status of how local youth are being targeted right here in our very own counties, as well as across the country. Now I'm going to turn it over to Emily, Lauren, and Caden.
Yay. Thanks, Carrie. As she said, I'm Emily Carpenter, the Youth Facilitator and Outreach Specialist, and our other presenters today are our Porter County Voice Youth, Lauren and Caden, and I'm going to just shoot it to them right now.
Okay, so over time, the way tobacco companies market their products has changed. The pictures you see on the left are just a few examples of what tobacco marketing used to look like. Tobacco companies used to have cartoon characters like Joe Camel, which directly appealed to kids, and they used to give away branded gear like t-shirts and hats. They also used to advertise on billboards and sponsoring sporting events. As tobacco advertising has been restricted, tobacco companies have had to adapt and change the way they market their products. Now, instead of billboards, sponsorships, and branded gears, tobacco companies spend most of their time marketing dollars at the point of sale. In other words, in stores where tobacco is sold. The picture on the right gives a snapshot of what point of sale tobacco marketing often look like. So what is point-of-sale tobacco marketing? Essentially, it is a marketing tobacco products to consumers where they purchase tobacco in retail stores such as convenience stores or gas stations and grocery stores. Point-of-sale marketing includes things like price promotions or discounts on tobacco products, in-store tobacco product displays, product placement, and retail advertising. It's also important to keep in mind this type of marketing is not random. Retailers often have contracts with tobacco companies that specify where tobacco products have to be placed, at what height, and what proportion of the display needs to be dedicated to particular products. It is also a very intentional form of marketing, and tobacco companies know how it works. Tobacco companies also invest heavily in point-of-sale marketing tobacco. In 2020, tobacco companies nationwide spent $8.4 billion on tobacco marketing, over $1 million per hour. About 89% of that was spent on point-of-sale marketing. In Indiana, tobacco companies are estimated to spend about $284 million marketing their products each year. This equates to $42 per Hoosier annually. So why does point-of-sale tobacco marketing matter? The reason why tobacco companies invest so much money in point-of-sale tobacco marketing is because they know how much it works. First, point-of-sale marketing has shown to increase the likelihood that the youth will start using tobacco and progress to regular tobacco use. This is very important for tobacco companies because about 9 in 10 smokers start by the time they turn 18, and about 99% start by the age 26. Tobacco companies know that if the young people don't start using tobacco early, they likely never will, and maintaining a base of youth and young adult smokers is crucial for sustaining their business. Second, point-of-sale marketing makes it more difficult for tobacco users to quit. Research has shown that tobacco users exposed to point-of-sale marketing may experience more tobacco cravings, are more likely to make impulse buys, and less likely to successfully quit. Point-of-sale marketing therefore contributes to keeping current tobacco users addicted and to using tobacco. Finally, point-of-sale marketing disproportionately targets some communities. In particular, this type of marketing often targets communities with a high proportion of low-income or minority residents. Often, these groups are already disproportionately impacted by tobacco, so point-of-sale marketing contributes to disparities in tobacco use and tobacco-related diseases.
All right, so we know that the tobacco industry spends most of its marketing dollars at point of sale, and that point of sale marketing increases youth smoking, makes quitting tobacco more difficult, and contributes to tobacco use disparities. So now I'm going to shift and talk specifically about the tobacco retail environment in Porter and Lake County. When we study the tobacco retail environment, we often talk about density and proximity. Density is a measure of how many tobacco retailers there are in a particular location. In this case, we measure density as the number of retailers per 1,000 population. Proximity is a measure of how close a tobacco retailer is to another location, such as a school or another tobacco retailer. As you can see here, there's a large number of licensed tobacco retailers in Lake County. But generally speaking, Porter County has slightly lower than the statewide density, while Lake County has a slightly higher than average density. Retailer density isn't uniform, though, and they tend to cluster around each other. About half of all tobacco retailers are within 500 feet of another, and in these areas, smoking is more prevalent. In addition, it's important to look at the location of retailers relative to schools. Research has shown that youth smoking prevalence is higher in schools in areas with higher tobacco retailer density. Additionally, when retailers are located near schools, students may be more exposed to retail tobacco advertising. Lake County has twice as many retailers within 1,000 feet of a school compared to Porter County. These maps show tobacco retailer density by census tract. Blue is the lowest and red is the highest. Red areas have more than one tobacco retailer per 1,000 population. These are referred to as tobacco swamps because of the high density of tobacco retailers. It is important to pay attention to this since smoking prevalence is higher in these areas, as well as more prevalent in areas with lower median household income. These people are often already disproportionately impacted by tobacco use. It is important to understand what types of point-of-sale marketing are common among tobacco retailers. To do this, we collected standardized assessments of point-of-sale marketing in tobacco retailers. Porter and Lake County were 2 of 39 counties statewide where tobacco retailers were randomly selected to be assessed. The assessments were completed using the Standardized Tobacco Assessment for Retail Settings, or STARS, way easier to say, developed by state and community tobacco control researchers at Stanford and other universities. STARS has been used to assess tobacco retail marketing across several states and includes questions about tobacco product availability, price and promotions, and tobacco advertising. Overall, 2,985 assessments were completed across the 39 Indiana counties between February and April 2022. The largest proportion of stores that were assessed across all counties surveyed were convenience stores. We surveyed liquor stores, mass merchandisers such as discount stores, grocery stores, tobacco shops, pharmacies, and other retailers. Here you can see the breakdown of the types of stores that we assessed. As you can see here on this chart, nearly all of the retailers surveyed in Porter County sold cigarettes or menthol cigarettes. All retailers in Lake County sold menthol cigarettes. You can see the amount of other products we found too, and we'll talk later about the importance of those menthol cigarettes. In addition to assessing product availability, we also collected data on retail tobacco advertising placed outside of a store. This includes advertising like those in the pictures shown here, such as signs on building walls, in windows, or on gas pumps. This type of advertising is important because people don't even need to go into a tobacco retailer to be exposed to tobacco advertising. For example, kids can be exposed to these ads in a car while their parents are purchasing gas, or simply walking past tobacco retailers in their neighborhood. Even driving by, sometimes you can see them. In Porter County, we saw that nearly 3 in 4 retailers surveyed, and Lake County, we saw that about 3 in 5 retailers surveyed, they displayed some form of exterior tobacco ad. In general, the most heavily advertised products were cigarettes and menthol cigarettes, followed by smokeless tobacco and e-cigarettes. Overall, these results suggest that exterior advertising is quite common among tobacco retailers. And I hand it back to you, Kaden. There you go.
In addition to exterior tobacco advertising, we assess products and marketing tactics that specifically target youth. In particular, we assess the availability of flavored tobacco products. Although flavored cigarettes other than menthol have been banned in the U.S., other products are available in a wide variety of flavors, like e-cigarettes. Often, these are sweet candy or fruit flavors that have been shown to appeal to the youth. These pictures show cigar brands that are popular with youth and available in a wide variety of flavors like grape, cherry, strawberry, and chocolate. You'll also notice that these products are often cheap. In the pictures here, they are 2 for 99 cents, and they are often available in brightly colored packaging that may appeal to kids. We also know that the majority of youth who use tobacco use flavored products. Research has shown that most youth have tried tobacco first, tried a flavored product, and youth often indicate that the flavors are a reason for using tobacco products. What we saw from our store audits was that flavored tobacco products were very commonly sold. Across all counties surveyed, more than 9 in 10 tobacco retailers sold any flavored tobacco. This data indicates that the flavored products are widely available. We also know that flavored products appeal to the youth. This slide shows flavored product availability among retailers that sold various types of tobacco products that are often manufactured in flavored varieties. Over 9 in 10 tobacco retailers sold flavored varieties of these products. Ultimately, these results demonstrate just how widely available flavored tobacco is across retailers in Porter and Lake County in Indiana. It is important to take a little more time to talk about flavors, including menthol, and how it impacts our communities. We have seen how widely available menthol products are. In the following slides, we will cover how flavors, including menthol, are marketed and which communities are largely impacted, the history of menthol, and how it's still around after the flavor ban, the steps we can take to support the ban, and the situation in Indiana. We talked about youth targeting and how flavors including menthol are marketed towards youth. In addition to youth, flavored products, specifically menthol cigarettes, are targeted to other sectors of the community. Menthol is largely marketed towards our marginalized populations, including those who are African American and those that identify with the LGBTQ community. The commercial tobacco industry has spent decades targeting African Americans into a lifelong deadly addiction. Advertisements both inside and outside stores were 10 times more likely to be present in their neighborhoods. In addition, we see rates of increased use of menthol cigarettes among those that are a part of the LGBT community compared to those who are not. Because menthol masks the deadly toxins in cigarettes, many menthol smokers are now likely to attempt to quit smoking if menthol cigarettes were banned nationally. A menthol ban won't solve, but it will help mitigate some of the disparities in health outcomes. Commercial tobacco manufacturers have used menthol cigarettes for years to target vulnerable populations. In fact, according to national surveys, menthol cigarettes are the source of addiction for nearly half of all teen smokers. Menthol increases the palatability of smoking, especially among young and members of racial and ethnic populations. And menthol increases the difficulty of quitting. Yet when Congress prohibited most cigarettes with flavoring as a part of the 2009 Family Smoking Prevention and Tobacco Control Act, it exempted the most important flavoring of all, menthol. You can see the timeline here where the Tobacco Products Scientific Advisory Committee tried to make headway but was resisted, making it difficult to address menthol. What is menthol and why is it added to tobacco products? Menthol is a flavor additive with a minty taste and aroma that is widely used in consumer and medicinal products due to its reported cooling and pain-killing properties. When used in cigarettes, menthol may reduce the irritation and harshness of smoking. Flavored cigarettes are heavily preferred by both youth and young adults. This was seen in a recent study where more than 80% of those ages 12 to 24 that smoked reported using menthol cigarettes. Additionally, when looking at any flavored tobacco use, 80% of those 12 to 17 using tobacco are using a flavored product. Flavors are commonly a reason cited for using tobacco products.
Thank you. Ooh. What does menthol do other than reduce the irritation and harshness of smoking? Menthol facilitates initial use of tobacco products because it makes it easier, deepens addiction, increases dependency, and suppresses sensation. When waking up, people who use menthol are more likely to wake up and immediately use than those who do not. Menthol can also cause more withdrawal symptoms, and industry documents point to studies on manipulating menthol to promote addiction. Overall, menthol makes it easier to start and harder to quit. We know stores sell these products because youth like the flavors. We've talked about that multiple times today. In 2018, we asked middle school students and high school students in Indiana why they chose to use cigarettes, and the most common reason was because of their availability in flavors. We know that retailers sell a variety of flavored products, and we can see from this slide that youth are using a variety of flavored products. As noted before, nearly 3 in 4 middle school students and 4 in 5 high school students who use tobacco are using flavored varieties of these products. E-cigarettes remain the most popular flavored product used, but menthol cigarettes are also largely common among youth. When we talk about flavored products, we need to always include menthol. It should be noted that like candy, fruit, or other flavors that are used to target youth, menthol has a history of being used to target not only youth, but also specific adult communities. In Indiana, we have seen that youth use menthol cigarettes, but also adults, specifically those who are African American or members of the LGBTQ+ community. We can see here that nearly 90% of all African American adults that smoke are smoking menthol cigarettes. So where are these menthol products being sold? Basically everywhere. Well, we saw in Porter and Lake County that nearly all tobacco retailers sold menthol cigarettes, similar to what we see across all of Indiana, indicating that these products are readily available. Additionally, we looked at disposable e-cigarettes, which are popular among youth. In Porter and Lake County, among retailers that sold disposable e-cigarettes, 9 in 10 sold the menthol variety of this product. We also know from collecting this data that advertisements for menthol cigarettes is quite common. Advertisements for menthol products were seen on the exterior of more than half of tobacco retailers in Porter and Lake County. This means that even those that do not go into those businesses are being bombarded with these advertisements. And like I said earlier, it could be adults, it could be children in cars, it's everybody.
So, what are the calls to action for our community? State and local communities should continue to prohibit sales in their jurisdictions. We need to monitor FDA actions and provide feedback on proposed rules. There needs to be support for tobacco treatment, such as the 1-800 Quit Now hotline, and we can combat misinformation and industry attacks by educating ourselves at events such as this one. Here are some key partners with us. As you can see, we have a lot. In addition to flavored products, some tobacco marketing tactics, such as the price and placement of tobacco products, particularly target youth. Youth are a very price-sensitive population. They often don't have a lot of money to spend on tobacco products, so cheap products tend to appeal to them. Often, tobacco products such as cigars are priced much more cheaply than cigarettes, available in a variety of colors and sold in multiple units per pack. Here you can see pictures of just how cheap some of these products are, as the pictures on the left show cigars priced 2 or 3 for 99 cents. Tobacco products and tobacco ads may also be placed where they are highly visible to kids, such as at the child's eye level or near candy, soda, or toys. In the middle picture, for example, you can see e-cigarettes placed on the counter near gum and candy. These types of marketing tactics were fairly common among retailers surveyed. Nearly half of retailers in Porter County had tobacco ads placed within 3 feet of the floor, and a third of tobacco retailers had tobacco placed within 12 inches of kid-appealing products such as gum. Additionally, nearly 9 in 10 retailers in Porter County and Lake County sold single cigarillos. This indicates that these products are often sold at very cheap prices, which makes them more accessible to youth. It's also important to remember that these products are often available in flavored varieties that directly appeal to young people. Finally, we also collected data on price promotions on tobacco products. Price promotions are important because they represent the largest category of tobacco point-of-sale marketing. Tobacco companies spend more on price promotions than any other type of advertising, and it's such an important part of their marketing because one of the best ways to reduce tobacco consumption is to raise the price of tobacco products. Tobacco retailers, therefore, offer price discounts to appeal to consumers and offset tobacco price increases. These pictures show examples of tobacco price promotions such as coupons. Retailers may also offer multiple pack discounts, such as the picture on the right that shows cigarillos advertised as buy 10, get 1 free. Overall, it was quite common for tobacco retailers in Porter and Lake County to offer price promotions. 68% of tobacco retailers in Porter County and 57% of tobacco retailers in Lake County offered promotions on any tobacco products. This was slightly higher than what we saw across all counties. Among retailers in Porter and Lake County, we saw that price promotions were most commonly offered for menthol cigarettes. Overall, this data indicates that price promotions are a fairly common marketing tactic among tobacco retailers in Porter and Lake County and across other counties in Indiana. We also gathered data on the price of specific tobacco products. You can see the table here and the disparities between Porter and Lake County, as well as the average across all counties. For example, in Porter County, the average cheapest price of a pack of cigarettes was $5.68, slightly higher than the all-county average of $4.85, but still relatively cheap, probably about what you typically pay for a grande latte at Starbucks. The key takeaway is that cigarettes and other tobacco products are still available at relatively cheap prices. Ultimately, this makes tobacco more accessible to consumers, and particularly to price-sensitive individuals like youth and low-income adults. So what are the overall takeaways of what we know about point-of-sale tobacco marketing? First, we know that the tobacco industry relies heavily on point-of-sale tactics to market their products, spending 95% of their annual marketing budget on point-of-sale marketing. Second, we know that point-of-sale marketing encourages youth to use tobacco, makes quitting tobacco more difficult, and disproportionately targets some communities, which contributes to disparities in tobacco use rates and tobacco-related health outcomes. Finally, a high proportion of Porter and Lake County tobacco retailers engage in point-of-sale marketing tactics, include displaying tobacco ads, engaging in price promotions, and promoting cheap, flavored, youth-appealing products. CDC's Office on Smoking and Health, in collaboration with the University of North Carolina at Chapel Hill, recognized the retail environment as a key component of effective tobacco control efforts. This is what they have to say about what they found. The retail environment is used heavily by the tobacco industry to promote and advertise its products. It is therefore also an essential environment for further reducing smoking, as well as improving racial, ethnic, and socioeconomic tobacco-related disparities. This commentary provides an overview of the importance of incorporating strategies focused on the tobacco retailer environment as part of a comprehensive approach to tobacco prevention and control. To reach tobacco endgame targets, such innovative strategies are a complement to, but not a replacement for, strategies that are long-standing and have been shown to be effective. Smoke-free policies, tobacco price increase, media, access to cessation.
So what can we do about all of this? That's a lot of information I just gave you. It's a little overwhelming, right? Well, unfortunately, in Indiana, there's preemption on regulating tobacco retail at the local level. This means that only the state General Assembly can regulate the sale, distribution, or display of tobacco products. And local governments cannot enact their own regulations on how tobacco is sold, distributed, or displayed. That doesn't mean that nothing can be done, though. Don't be discouraged. The first step towards changing any policy is building grassroots awareness and support, and that's where we need your help. You can help raise awareness of point-of-sale tobacco marketing by sharing this information with others in our community, particularly people in your sphere of influence, like coworkers, peers, family, friends, and others. You can tell people on the street if you want to. I do sometimes for fun. You can also join our coalition if you want to be involved in a more organized way. You can join Voice if your age is 13 to 18. Talk to me. Or if you have a teen that you know that might be interested, also talk to me. You can stay connected so we can help you stay up to date about local and statewide tobacco control issues. This helps make sure you have an opportunity for your voice to be heard about a whole range of tobacco control issues. Finally, you can always partner with others in our community to help build healthier environments where we live, learn, work, and play. This might be by partnering with a neighborhood association, local schools or universities like Valpo, parent groups, youth serving organizations, the faith community, and many others. Many voices are stronger than one, and building these partnerships helps build the grassroots support we need to protect our kids and families from tobacco and make our communities healthier. Thank you. Also, you guys did a great job. Thank you, guys. You're amazing. So what questions do you have? Any questions? Sure. I mean, you're loud, right? I'm loud, too. I don't need a microphone.
Specifically for the youth, so how do you believe your peers are getting e-cigarettes and tobacco products? So obviously they're probably under the age of 21.
I'd say a lot of like older friends and siblings I know are buying for people who are younger than them. Sometimes parents, which kind of sucks, I've seen before, but usually it's older siblings or peers who are older than them.
Anybody else have a question? Great question, by the way. It's literally insane. Sometimes we see that parents will buy them for the teens. They pass them out at slumber parties. They give them cases to sell at school. It's a little outrageous here that happens, but good question. Anybody else? You have another question? Okay.
So, let me talk, I can just yell. So, okay, I'll talk into the mic. So there was a pretty large discrepancy between the number of retailers in Lake County versus Porter County. Can you share a little bit about that and why is that the case?
Let me find the slide real fast. The number of tobacco? This one?
Yes. Yes, so 538 and 126 is pretty big difference.
That is a pretty big difference. I don't know if I'm equipped to answer that question, if I'm being honest with you.
Size.
Size. It's so much
just-
bigger there. There's a lot more space.
We actually went to 135 places, but sometimes we don't get complete information and we couldn't. But that's still way less than Lake County's 538, which they probably had an even higher number that they went to as well. But we're just a little bit smaller. Yeah.
Yeah. She's coming.
Just the density is what you look at, because obviously Lake County is a lot larger than Porter County, and that accounts for most of it. But the density, if you want to talk about, you can say the density of providers, 0.8 versus 1.1. That's the proper comparison.
Yeah. And they're in like we're about average. I mean, 1 is the average, right? Or 0.9 is the average in Indiana. So Porter County is about that average. Lake County is slightly higher than that, so they have more of a density in that area. Anybody else? You again?
I'll ask another question. So this is for the youth. So you go to the same school. So do you have tobacco retailers close to your schools and close to other places that your friends go to? So whatever you like to do for fun, or your house even.
Yes, I would say that we both go to Boone Grove High School, and I would say within 5 minutes of the school, it is pretty easily to get access to any type of product that you're looking for.
And do you know of specific, so follow up and you can answer both, do you have specific retailers here? So I'm from Kosciuszko, and so my son Cayman's going to be speaking later, but we have specific retailers that the youth know those retailers are going to sell them tobacco. So do you know from your peers if there's specific retailers in Lake and Porter that are known to sell to young people?
I know that a lot of people used to go to the Tobacco Island that was like by like the Smoothie King and Crown Point or whatever, but they started shutting that down. I know because like people would be like, oh, like the cops are waiting outside. I remember hearing that. I know there's a few other places, but there's definitely a lot that they'll know and they'll go to because they know that they won't card. And sometimes like it's just if you have an account there or if like they won't even look, which it sucks because that's so easily for kids to get it.
And I think there really are just like hot spots in general. People gravitate towards the same area, and once one person finds out that they can easily get a product one place, then it can spread. Especially, we go to a very small school where there's about 100 kids per class, so it's something that definitely gets around.
We have an issue here in Porter County right now where there's a vape store that popped up in May right across from Willow Creek Middle School. And it's breaking the Indiana code, and it's being investigated as to what's going on. I've had a meeting with the mayor. That's a big issue. If you could literally throw a ball and hit that vape shop, which has a giant bong in the window, and they said the biggest problem they have with it is there's lights around the windows that they don't like. Well, we don't like it facing the school or being close to the school, so we're working on that with prosecutors and excise and everybody else. And the mayor is totally against it, wants it gone, trying to figure out how that happened. But, you know, we see that happen. And there's enough marketing on the way to that school. The gas stations are just littered with the doors, the windows, the kiosks over the poles that protect the store. It's ridiculous how much marketing they put.
I don't have a question, but I'm from Lake County. I'm a part of their voice team. And I know at my school, I go to a small school. My class size, there's only about like 105 people. And like during practice, like kids will like leave if they have maybe, 30 minutes before a game. And they'll go like walk maybe like 4 minutes and they'll get tobacco products and bring them back, hide it in their gym lockers. Wow. And that's just crazy. I mean, those are athletes. They're supposed to demonstrate good behavior, and they're putting it in their lockers, and it's so easily accessible for them. Yeah.
As somebody who went to Willow Creek Middle School, I know definitively you can see that sign from inside the gym. So those kids are looking at that like daily, which is outrageous to me.
First of all, I want to commend all our youth that are speaking, because a lot of the adults in the room want to hear your perspective. So, thank you for sharing today. I would like to discuss the slide with flavors, and just get your perspective about your peers on how the importance that flavors play a role in, the introduction of vaping. And then twofold, you have a lot of community members that work with youth and young adults. And so what would be a key message that you think from a youth perspective that you could give some of these adults? So twofolds, just talk about the flavoring and how that introduces your peers. And then secondly, what would be a message for all these community members to go back and share?
I think the whole flavoring thing kind of goes hand in hand with like how it does with alcohol, because kids aren't going to want to like have something that tastes bad like just for it. So like if it tastes good, that's like, and they're like, oh, it looks fun, or like somebody else is doing it, that's not going to stop them, because they're not going to do something that tastes bad like right at the beginning. But if they get introduced to something that tastes good and they start craving it, they're not going to care how it tastes after a certain point. I don't know. I'm going to have to come back for the message, but I'm going to hand it off to Lauren.
I definitely think that the flavoring is the main draw to kids, students our age. They're looking for something that's fun and something that'll get them feeling a little bit less stressed out in life, and this is just really a good outlet to them. I would say that a good message is a lot of people look to a certain type of group, to the students they think are doing these products, when I really think, being in the school community, that there are so many people. I would say probably 75% of the students at my grade have at least tried some of these products. And I think that more so the prevention is targeted towards students that fall into certain groups. And I think that then that allows some of the other students to more easily get away with it. Like you had said, student athletes, they're supposed to be these perfect, like, follow this certain type of whatever, and I feel like that most people overlook that, and I can just personally say that I know a ton of people who the school looks at as being the best type of people, and really they are using.
I think that's really interesting that Lauren brought that up, because I just was looking at some research, and I saw the research say that one of the mistakes that schools are making is they're trying to pinpoint the group of kids that are vaping. There is no vaping group. I guess if you're a vapor, then you're in the group, but they can't target strictly athletes. Or, back when I was in school, you were an athlete or a stoner, or, there was specific categories, and you kind of fell into at least one or two of them. Now, no, it doesn't matter. Any kid can vape. It doesn't matter if they're an athlete or a scholar or what they are, but the research is showing they're vaping universally.
So I'm an SRO from Hobart High School, and I was just, since I have a chance to ask some students who are knowledgeable about this, how do you feel your school's efforts to combat tobacco use and vaping are? How effective are they? What would you like to see them do differently? I know we mentioned about not targeting groups, but it gives me a chance to actually speak to young people and get some feedback.
So our school, usually a lot of the kids will go into the bathroom to vape because it's like easy. But our school this year put up vape detectors, and within like the first day, they like were able to catch like 7 kids, and they got like, I know, like a gallon-sized bag and like another half of the gallon-sized bag of products, like vapes, marijuana vapes. I know they got that. So it's been a lot more effective to at least keep it out of the school, which is good. I mean, I know they're not taking it away completely, but their efforts are there. And I do think that they really do try and like, they act like kids won't, like good kids or like student athletes won't do it, but they do. And I mean, even like, I don't know. Sometimes I think that the like drug testing isn't like random when they pick it, but that's besides me.
I think that, like he said, the vape detectors are definitely an effective approach, but I think there are certain things that honestly, I feel more promote kids even. We have some posters around our school that are on like the bathroom doors, and it's almost become more of a joke with students. They like to like make fun of certain things, and I think that mainly the most effective way is to start within. For example, Kate and I being a part of this, I think being youth, talking to other youth, spreading that message amongst our peers, that's the way to combat the issue. Then I feel like we all know that high schoolers are sometimes rude and they like to mock and mimic, and I think that these posters or certain advertisements around, they, I don't know, make fun more than follow them.
I can tell you from experience in working with the schools and talking with Kaden and Lauren, and talking to students after I give a presentation versus when they give a presentation, they listen so much more when they speak than when I speak. They're like, oh, that's another adult, whatever. It's like la la in one ear, out the other. And when they speak, they're like, wow, I didn't know that. I'm like, I just said that. But that's fine. It's cool. Don't listen to me, but listen to them. So the peer-to-peer thing is probably the most effective, at least that I've found working in this position about a year. So you want to move to the panel now?
Sure, but that's why we push so hard to have students work with our youth facilitators and with our tobacco coordinators so that we can have youth like these in the community to snowball and build that up. We try to get representatives from every school system in our county to participate, and it's very difficult for them to we even try to get them to elect a couple students per school, knowing that if we can get a couple students in each school, it might snowball there. But we need your help. If you're educators, please, help us try to figure out how do we work within the channels within your school system to get those couple students who could help us grow our program throughout the county and be the voice that comes back to your school to educate your own youth in your schools. But then we're more powerful, they're more powerful, their message is more powerful if we can grow this group. But it's very hard to kind of get it going within the schools or within youth groups, even churches. We have pounded on doors of churches, and they all say, yeah, that sounds great, and then we hear crickets, nothing. So if you can reach out to one of us, if you're in one of our counties, we would love, Emily would love to hear from you. We would love to come in and talk to any honor society, youth group. If you're giving points for service, some schools are starting to give service now, points for service hours. We would love to work with students and even maybe just collaborate on an effort or an event that your school's already doing so that we could have discussions with the youth and let them know what we're about. So they could talk to Emily, Irene, or I to get that set up. So we would love to have your support with that.
All right, thanks, guys. I'm going to move to the next thing. So the next thing we're going to be doing is a panel discussion. The youth are going to lead this. We have some awesome community leaders joining us today, but first I'd like to introduce the youth that are going to take over for this section. Mika Neely, she is a Voice Corps team leader, and Cayman Blake is a Tobacco Free Kids ambassador, and they'll be moderating this discussion. So you guys want to join me up here, or just you, I guess, if you guys want to pop down. I'm going to introduce these leaders that are going to be part of the panel if you want to come on up. First we have Risa, I hope I'm saying that correctly. Yay, thank you. Ratney. Mrs. Ratney is a public health administrator with over 25 years of experience in maternal child health programming. She is currently working with the Northwest Indiana Health Department Cooperative to coordinate the activities of the Lake County Fetal Infant Mortality Review Program. She also serves on the board of directors for Community Health Net, Health Centers, and the 16 Pearls Foundation. She is an active member of several community-based committees and initiatives that focus on improving health and well-being. During her personal time, she enjoys gardening, bike riding, walking, and strength training. Same, also. That's amazing. Next, we have Eric Evans. Mr. Evans is a certified prevention specialist and serves as the director of prevention services at Geminis Corporation. There, Mr. Evans provides oversight to multiple grant-funded funded initiatives focusing on suicide prevention, mental health promotion, substance misuse prevention, LGBTQ plus competency. Mr. Evans provides training to local school districts, community stakeholders, social service agencies, and throughout the United States. The most important role for Mr. Evans is that of father of his 2 young kids. Then we have Stacy London. Mrs. London is the statewide youth coordinator with the Indiana Department of Health, Tobacco Prevention and Cessation Division. She has embraced the mission of engaging, educating, and empowering young people as leaders and advocates in their communities. Key to this task is developing youth-adult partnerships, positive youth development, and public health advocacy training, which she has done with me. She's amazing. Thank you, Stacy. Mrs. London enjoys spending time with her family, and she loves to make pies. Her specialty is a derby pie, reminiscent of her home state of Kentucky. I didn't know that, but I'd like a pie now. And Dr. Richard Hugg, PhD, has spent many years dedicated to improving the quality of life in Northwest Indiana. He has been a strong advocate for marginalized communities, children, and underserved families. Dr. Hugg has contributed countless data analysis on environmental and health conditions in Northwest Indiana that enhance the work of many local community programs. To this day, even in retirement, Dr. Huggs finds ways to continue his dedication toward Northwest Indiana, and there are many of us who are grateful. I'm so grateful for this whole panel. You guys sound amazing. I'm so happy you're here. Thank you so much.
I'm Cameron Blake. I'm a Campaign for Tobacco Free National Youth Ambassador. I go around the state, trying to go around the nation sometimes too. I've been to DC and the State House multiple times trying to prevent tobacco getting in the hands of youth and make sure it's being used responsibly by adults. I've helped get Tobacco 21 passed and attempted to get the tobacco tax raised in Indiana. I'm motivated because when I was in the 2nd grade, my grandfather died of cancer due to smoking.
Hi, everyone. I'm Mika Neely. I'm a junior at Edison and Lake Station. I've been with Voice now for about 5 years, and I've been the president for 4 years? 4 or 3 years now. It all blends together after so long. What really drew me to getting into Voice was I saw an issue with my peers. I saw how vaping and nicotine and tobacco products were getting in the hands of my youth and how it was affecting them. Athletes, it was making them, they had those nasty coughs. And I just saw how students, they would be vaping in the back of classrooms instead of paying attention to their teachers. Their grades slipped. They were so focused on getting their fix in for the day and not to their classwork. So I decided to step up. I have a voice. I feel the passion to use it, to step up and help educate and empower my fellow peers against the harmful tobacco products and nicotine, and just help them out, help educate them. So hopefully you enjoy our panelist discussion.
In the last presentation, we heard about the impact flavored tobacco has upon marginalized and minority groups all around Indiana. With the current movement to remove flavored tobacco products, including menthol and vape products, from the market in an effort to protect our youth and our generation from the huge cause of death that is tobacco use, would you agree, panelists, would you agree that we should expect the FDA, state, local, and federal governments to do more to save lives and support policies that protect all people? We don't have a mic up here. Test.
Thank you. Tell me your name again.
Cayman.
Okay, all right. All right, so the question was, should we expect the FDA and...
Local, state, federal governments to attempt to protect our youth?
Oh, absolutely.
Products of tobacco.
Absolutely, I think you should. And this is a wonderful platform for you to begin that type of advocacy around this issue. So yes, you should, and I think we'll probably talk about maybe some ways to do that, but yes, that should be your expectation. Now, that's not to say that it will be easy, but it should be your expectation.
I think she kind of answered it for all of us. But I do completely agree. We should expect our government to put the health and the needs of our citizens, of our communities first. And so I'm hopeful that through more understanding and knowledge, because I think oftentimes the knowledge is the part that slips. I don't think they fully know or understand. And so I think the more that we can ensure that our politicians are aware of truly the impact that it is having on young people as well as adults. And I think if we can ensure them, I think if they understand, and I think that's the hardest part, is to get them to truly listen. And so that's where I think youth have such a strong voice, because it sometimes can go against deaf ears when it's other adults, but I think when youth come together and they speak towards it, I think that the impact can be much greater.
I would totally agree with you. But I would also say that it is everyone in the community's job. You heard the presentation. You were educated. You have knowledge now. So I think it's every community members to protect our youth and our young adults. So, I would kind of challenge you to defend your own community, to get involved, and to make sure that your community leaders are educated so they can help push and make the right decision.
I think we should expect the FDA to enforce the law, to move forward on that thing. But we should not be surprised if they are thwarted in their effort, because we know a lot of things. I taught statistics, and the thing about in policy, and we have, in many cases, we have information that is clear about the policy implications. We know what makes the most sense in terms of public policy, but that does not mean that it will happen. That if we neglect the political component, we cannot expect the FDA to do what we expect them to do without the support of politicians. And to do that, we have to do our part on that front. So expect the FDA, yes, we should, but count on it? No, we can't count on it without doing our part, and that involves the political side.
We just saw the 2022 point of sale data on the density that showed 25% of 538 tobacco retailers in Lake County and 18% of 126 tobacco retailers in Porter County are within 1,000 feet of a school. We have the research showing that youth smoking prevalence is higher among students in areas with increased tobacco retailer density. In addition, students that are frequently exposed to retail tobacco and advertising have a greater percentage of vaping products being safe. Panel, how can we get more community leaders to address the issue of tobacco retailers and vape shops being so close to schools?
When we start to normalize substances and we start to normalize tobacco use, we start to normalize vaping, we create the environment for our students and our young people to see this on a daily basis, then they're just going to fall in line with that. And so when we're having these shops nearby where our students are walking to and from school, and this is what they're passing, this is what they're going to start to learn as what is expected or is okay within their communities. And so here, I think this is one of those very much on the local level, that, businesses and organizations oftentimes have to petition to be able to start their companies, their zoning rules within each community. And if we can better educate like the zoning departments, and we can better educate our town councils, our city council members, then from a small perspective within community by community, we can start to bring about these changes. And when we're looking at the larger picture of the retail, I don't think we're going to get movement from the state level. I'm confident we're not going to get any movement from the federal government. So I think if you want a change around kind of the zoning and you want to ensure that our students can go to and from their school and they can be a few blocks away from their school and not have all of these tobacco imageries and messages in front of them, we're going to have to get our local council members and our local zoning departments to be aware of that.
Okay, I would like to use the voice mission that our young people follow. It's really going to take for you to engage in your community, to educate your leaders, and to empower them to make the decisions. And that's what our young people. So I challenge you to allow your young people to be a piece of that puzzle, to share their voice. When you're going to a city council meeting, make sure that the power dynamic is equal to, it's your role as an adult to allow them to share their voice. They are very powerful in their communities, but it is going to take your community to engage with those. You have to get out of your comfort zone. You have to be able to speak out. Have the information that you've gathered from this presentation to educate, and then go back and empower them to make decisions in their own community.
I agree with everything that's been said so far, but I also want to add the dynamic of pressure. So what they're saying basically is that you have to educate your local community, educate your local leaders about it, but you also have to make sure that you don't let up with that. So it has to be a constant message. It can be a constant message from a variety of people, but it has to always be there. So if it's not on their agenda by their choice, try to see if it can be on their agenda. There are probably a lot of different tactics about how people always get their message out, but those things that are won't land you in jail, but still, kind of keeps pressure on those that could make a difference. Keep it in front of them. I think that's basically it. You got to keep it in front of them and let them know that this is something that, is important and it makes a difference. Because, particularly when you're talking about those influences on youth, it's a difficult time as it is, just transitioning and understanding who you are, and then you've got so many different things that you can choose from, so why put that there? So again, it's just educating and pressure.
Alrighty, I actually have a further question for you if you want to pass her the mic. Sure. What do you feel like would be a good example to keep the pressure there for them?
Well, showing up at the council meetings and any places where decision makers are. But again, doing a lot of community education and showing people why this issue is important. A lot of times people focus on those things that are important to them primarily, number one. But if you can interrupt that, then they will listen to you as well, because it might be, oh God, I didn't know that. And then when you really think about it, well, that shouldn't be there like that. And you can begin to kind of snowball your support and the advocacy to force that change.
That was a great answer. Thank you.
Anybody else want to add to that?
Many of our peers begin working with positions in the hospitality industry and possibly continue for many years. According to research by Dr. Glanz at the University of California, the tobacco industry has manipulated the hospitality industry by spreading a myth about loss of profit when smoke-free air laws are initiated. Research shows that there really is no loss of loss of profit, and in many cases, there's actually an increase in the number of patrons and profits when businesses are smoke-free. As a community leader and someone who is concerned about the health of others, panelists, what do you think should be valued more, the life of the workers or the profits of the tobacco industry?
Well, that's an easy, that's not a tough one. That's not a tough one for me. It wouldn't be a tough one for our voice youth. And you just need to flip the script, when you're going into those smoking establishments, what is the percentage? How many people are you really protecting versus, given the right? So I think you just need to flip the message and just say the best way to increase health overall is to have smoke-free establishments.
The idea, I think one thing that might be particularly effective is the idea of we value freedom and that sort of thing. But I think the argument that has been most persuasive to me is that the workers who are in those establishments, they do not choose. We know what secondary smoke does. They don't choose to do that. So the appeal to freedom is one, well, they deserve to be free from smoke. So even though you would defend someone's right, someone's freedom to do these sorts of things, you should not impose that on others. And I think that is a very powerful argument that we need to consider more often than we do, I think.
Well, and just to follow up, we're not taking away their right to smoke. You can continue to smoke. We're just asking you to go outside to protect those within indoor communities.
Oftentimes, the profit is of primary concern. It's going to be the primary concern of management for the establishment. It's going to be, if there are investors or a board, they're looking for a profit. And if they think any change or movement that they're going to make is going to potentially reduce their profit, they're going to steer away from that. But I think it's really important for those who are constantly thinking about, okay, we need to continue to make money and make more money, to start thinking about what is the collective impact that our country, our community is going to have because of the negative health impacts that it's having on these individuals. Because we know, individuals who are exposed to secondhand smoke have potential of greater health complications as they continue through life. And the longer you're exposed, we know that the greater those risks are. And so nowadays, healthcare is very expensive. And so who is going to be paying for that health care in one way or another is going to be, yet again, every individual. And so I think sometimes you need to identify with some establishments what is their, what is that thing that is important to them. And sometimes it is the money. And so then it's taking that conversation and talk about the money. Let's look at what your profit is, but then also let's look at what the expense you're bringing onto your community because of the negative health impacts, and then because of the healthcare costs that it's going to bring in the future.
Wow. I don't have a lot to add to that. I think that we all know that it should be people first, okay? We don't act that way, but we know it should be that way. Now, the flip side of that is that you have some communities that maybe have marginalized disinvestment, that maybe see that maybe that's not a strong argument for them, although we know it's the right thing. So again, that's when I first said that it's not easy, because we can see what's right, but it's not easy. Any business, the bottom line is what they primarily care about. And they'll do a lot of different things to see if you can, maybe try to meet someplace in the middle, and that is not really what you're looking for. But it still is worth the effort. And I think one thing too that is good is, when you can teach by example and you can show where, the profit margin is not going to be that altered, or there could be some other benefits that are not necessarily monetary that could, add to goodwill or things like that. But not easy.
Commercial tobacco use and the constant surge of new products is the leading cause of health disparities and social injustice for our nation. State and local communities, specifically right here, Lake and Porter counties, Indiana ranks 41st in the nation's overall health. The recent Surgeon General's report on smoking health stated that 5.6 million children alive today will ultimately die early of smoking if we don't try to prevent this. What is your advice to young people here today to get started on fixing the inequities in our community and preventing 5.6 million children today becoming addicted to smoking and dying?
Well, I think we get back to what we've been consistently saying about education. First off, educating the community, educating your local leaders, having a presence in front of those policymakers. I was working with a federal program some years ago, and one of the things that we made sure that we did was to go to the Hill and, go talk to our senators, our congresspeople, and present our case to them in terms of, my area was infant mortality and the causes, which is why I'm interested in that, because we do see poor birth outcomes. So it's a matter of staying vigilant in terms of getting the word out about the poor outcomes, the bad effects, and keeping the community educated and the leaders educated.
It's challenging to stay up with the tobacco industry because they're constantly looking for that new product, because we know that the political system is a very slow process. And so they continue to work to stay in front of it. And you can see that by the changing of products, the changing of chemical combinations, the ways in which they can modify just enough so they can be in compliance with the law. And so it's very challenging for, I think, lawmakers to be able to keep up with the constant changes. And so I think one of and a preventative standpoint of it would be to really continue and to help our politicians to stay on that forefront when it comes to tobacco. That while we want to take every win as that win and every opportunity to be able to protect more people, but we need to also know and understand that that's not the last time that we're going to have to address this, because we know the tobacco industry is going to roll out with another product or something just different enough that they can circumvent or fall into a loophole. And so I feel that this is a battle that our society, our country has been undertaking for decades, for centuries. It's ongoing and it's going to continue. And so I think that we need to know that every win that we get is a great opportunity to protect more people, but we need to then be looking at the next one, because the tobacco industry is going to continue to be looking at that greater profit. And so I think that we need to keep that momentum going even when we have our wins along the way.
Yeah, I would agree with you totally with working with our legislators and really educating them that we continue to need this funding, but not only for prevention. I would build upon that to educate anyone who is in contact with a youth and young adult about that cessation piece. You heard this morning about the power of addiction, and you heard from Lauren that it's not just one group that, vapes. So really driving home that messaging that, it's not a bad choice. It's an addiction. And these young people need our support. And to get that support, we need the continued funding. So I would just build upon that besides just the prevention piece.
Persistence, Risa mentioned, Eric followed up on it. Persistence, persistence, persistence. That's what it takes. You go to a hearing, you get to know a legislator. You go to another hearing, you see the same legislator. They begin to trust you. They begin to listen to you. They begin to hear the research, which is very clear. They know that someone cares about this issue. You go back again, you go back again, you go back again. You are their go-to person on these issues at some point. But it doesn't happen unless you're persistent. You stay there, you stay after it year after year after year. I would say with infant mortality, and Risa worked on infant mortality, it was a difficult and remains a difficult problem, but progress has been made because of persistence by public health specialists like Risa and others in the field. Be persistent, be persistent, be persistent.
This question's directed to Ms. Stacy London. To close out our discussion, what is our call to action?
Wow. There was so much good information shared with you all today. And you know, I kind of put this out to you before. You know, it is your responsibility to defend your community. And you are experts in your community. So I like symbolism. I like imaging. I would say that you're each a different the vendor, you know, in your community. You have your own specialty, and I would challenge you to look to see how tobacco control, tobacco prevention, you know, education with cessation, how can that fit into your role that you do? How can you partner with these funded communities to better your own community? And so that's how I would just tie it all in.
Questions? Do we have time for questions? Okay. And then does anyone have any questions?
I do, but I'm loud.
Okay, good.
So you keep saying educate, educate, educate. So my question to you is there too young to start educating young people on these issues about talking to the people in their community about the actual information that we shared today? Is there too young, or can we just start educating all people at all ages?
I'll just talk from a personal standpoint. You know, my daughter is 6. She's just started kindergarten this year, and we've talked about this for a few years now. We talk about what we see in our community, and we talk about it in an age-appropriate way. And one of the things that I'm very mindful of is I don't want to put the stigma on it as though this is a bad person. Because somebody who uses tobacco products, they're not a bad person. And so I think we need to be very careful. I think sometimes the ideas of prevention, or sometimes we like to label individuals within, you know, who suffer from an addiction. And because that's what we know that it is, that the addictiveness of nicotine. And so we've talked with her for a number of years about what it means to have a healthy body. And we talk about food that we ingest. So we don't leave it just in one area. So we don't only talk about tobacco, we also talk about food. You know, we also talk about, you know, what is daddy juice versus what is kids juice. But then we talk about those things to a length and an understanding of making those good choices. What do you want out of your body? Because what you want out of your body is going to impact what you choose to put into it. And that's our conversation around the use of nicotine is, you know, do you know what that is that's coming into your body? What does it feel like when you're, you know, when daddy's burning dinner and you take in a big breath of it? You know, that doesn't feel good, that doesn't smell good, that doesn't taste good. And then we talk about what is it like when we're up at the dunes and we can take a good deep breath. What does that smell like? What does that taste like? What does that feel like? And so we can have these conversations even with little kids to understand. But the big thing that I really stress with her, because she just did it a couple days ago, that person's smoking, that's bad. And I was like, well, that's not a good choice. And I hope that that person can get the help that they need so they know that they don't have to do this. And so it's how we have those conversations and continue to have those conversations. If we can normalize these conversations, just as much as the thought of using nicotine products has been normalized in our communities, then I think we can get young people to see that it doesn't have to be just that way. But when we don't have these conversations with them, and then they start seeing it in TV shows and movies, and it becomes a more normalized part of their community, of their reality as they continue to age, then we have done them a disservice.
And I would just say utilize the resources that are out there. You know, the CDC know the facts. You know, they have specific ways to talk to your youth. So just utilize credible facts to educate. And I don't know if you're talking about formal education, but I would agree, you know, start the conversation at a young age.
You know, I don't really, I think both of those responses were very good, but I was sitting here thinking, if we ask again, if there are any other questions, I had one. And it kind of gets back to what you were saying about at what age, because I would like to ask the youth, at what age did you start learning about this? Your activity, your advocacy started in high school, I'm thinking, right?
It started my 8th grade year.
8th grade. Okay. Would you see any value or benefit if it was in elementary school, or was it? Was there some version of just a healthy body and what you put into your body? Did you get that, or did it kind of all land in middle school?
It all kind of landed in middle school. I feel like when I was in elementary school, vaping was definitely not as big as an issue as it is today. But I feel like nowadays it's such a big issue that it should definitely start in elementary school. I mean, even just as far as kindergarten, I mean, they're 5 years old, just educating them what these products are, you know, they're not good, and just educating on what they are.
Yeah. Now, and I don't want to start a conversation about, with parents, what they want. I'm just asking you, having gone through elementary school up into high school, your exposure to public health and healthcare in general, because I think that we have the responsibility of learning as well to find out, just how are we doing it right? What could we do better? How can we better? I love what you were saying, age-appropriate discussions, and the notion of just being healthy, because, in terms of what I do, I want women to have a healthy baby, but I don't want you to think about that when you get pregnant. I want you to be a healthy woman throughout your life cycle. So just wanted to kind of throw that out and kind of get a feel from young people if we're doing it right. So.
Any more questions?
Thank you. It's actually not a question, but I wanted to say it anyway. I don't know if this opinion counts or not, because I'm not like a teen, but I'm 23.
Every opinion counts.
Okay, I meant like age range, but I have two things to comment on with that, because it's something I've just been thinking about with the whole, when do we start teaching the youth things like that? Because for me, I think I started learning that in middle school, around 6th grade, but it was very jumbled and combined information, so I think there's definitely a way to deliver that information. I'm thinking about it now because I teach middle school now with wellness and mental health, because I major in psychology, so that's just something that I've been, tracking with. And one of the things that I heard yesterday come from a student, I'm not going to say what she said. It was offensive, it was racist, but the reason why I bring that up is because she repeated it back to someone else, and she's 6. She did not understand what she said, honestly. She didn't understand the implications, because she still played with said child who she said the racist remark to, and the child played back with her because he didn't understand either. And all the teachers were very taken back by that. And we say, well, she's learning something at home, right? She heard it from somewhere. And, we told the mom, and she's like, where did you hear that from? And she's shocked by it. But we're all just internally thinking, well, she probably heard it at home, And so it's been in my head all day, honestly. And I think from my personal perspective, that I honestly would honestly start thinking about talking about important topics like that with kids. I think, honestly, first grade. Because even if they don't fully register all the information, because obviously you have to deliver it a certain way so they understand, as you said, right? There's a certain way to deliver that message. But I honestly think it's super important to start in first grade because they're already internalizing different behaviors at home, So even if you just say, no, tobacco is bad, no, smoking is bad, at least they'll hear that at school, or in the educational program that they're in versus what they're hearing at home. So that's my 2 cents.
I concur with her about the age. I'm thinking 5 years old because just like you said, the younger, they're like sponges. They suck this stuff in, and as they grow, they learn, and when they get to middle school, oh yeah, I remember that. I mean, maybe a cartoon or something like that, age appropriate interventions or whatever. But 5-year-olds, I think, would be cool, to start it.
I love what you're saying, because what you're talking about is just giving kids an opportunity and a safe space to have a conversation. And if we can let them know and understand that it's okay to have this conversation when they're 5 and 6 years old, then when they get into that middle school and those challenges become a little bit bigger, hopefully you've already had that foundation, that you've already established that relationship where they can still come and talk to you about it. I think when we wait until they get to that correct age, which again, what is it? There's really no correct age because every child's different. We know the way that typical adolescent development is going to look very different from one young person to the next young person. But if we can, as the adults, as not just the parents, and first off, I believe parents and caregivers should really take a key step in this. But then looking at the other roles of adults that support young people in our communities, our coaches, our educators, our camp counselors, somebody, within your faith community. There's a lot of different adults who can build those relationships, those healthy relationships with our young people. And if we can empower them to know and get them to understand that they can have these open conversations from a young age, hopefully it's going to give those greater opportunities as they get older and those challenges become bigger, that they know that they can have a conversation without fear of punishment or repercussion. Because that's what I have seen is as they get older, they're afraid of what will happen if they bring up a topic. And if we can just normalize these conversations from a young age, then those topics aren't taboo or scary to talk about as they get older. That's just me.
Okay. I want to say thank you to our panel. As you have done for a while, and not aging you at all, but you continue to plant seeds in the lives of our youth, and we thank you for that. We appreciate you spending the time with them today. Now, to our youth, of course, my opinion is biased. You guys rock. And I want you all to know, as we say all the time, we got your back. So we're here, we stand with you, and we will continue to empower you in any way that we can. There is a message, and a lot of our legislators wanted to be here with you because they love talking to youth, but they were unable to be here. So we told them, don't worry, we'll call you up, and we'll get back on your schedules. So just be aware of that. But my opinion is very biased. We love these kids, and we do everything that we can to train them, to teach them, and to be with them, and to support them. And we just want our community to stand with us as we do this. And we want to thank you. Just thank you. And I'm going to turn it over to you, Donna, to give our